Earlier this week, we covered that Nova Scotians can now get take-home test kits for sexually transmitted infections. The clinical director of Halifax's STI Clinic, Dr. Todd Hatchette, says that many infections don't present symptoms, so the best line of attack is to make it easier for people to get tested. He joined us to explain why Nova Scotia has launched this new program.
We have seen increased numbers of cases of all of the common STIs that we test for. So things like gonorrhea, chlamydia, as well as syphilis. It's just another tool in the toolbox to increase access to care. So this program, in addition to facilitating collection by sending you home a kit, also works with a pharmacy team to link people who are positive directly with care. So it's a full spectrum of service from testing to treatment and to follow-up. And it's important because many STIs are asymptomatic. So it's important that we identify those that are infected so that they can get the appropriate treatment and that their partners can go and get tested and treated so that we stop the spread of infection. We know that some people aren't comfortable discussing sex with their primary care physician. If they have one, it's a bigger challenge in many cases to have a primary care physician. So this is one of the ways that we're trying to increase access. And even those that have primary care physicians, they may not feel comfortable for various reasons. They're embarrassed or they've suffered some trauma in the past and don't feel comfortable discussing these sort of things with a physician, or they have other reasons where they would prefer to do it in a more anonymous fashion. When people send in their specimens, we test them in the lab. Any positive results go to a pharmacy team that we have here in the central zone at Nova Scotia Health Authority that will reach out to the individual and then facilitate either treatment with antibiotics at their local pharmacy, or if they have to be referred on to a physician for other treatment like an injectable for gonorrhea, for example, ceftriaxone requires an injection, then they'll facilitate that. So it's the sort of pharmacy team that quarterbacks that linkage to care.